The foregut, midgut and hindgut, they have got separate blood supply. That means they have got individually separate artery for their supply. For the foregut, foregut means abdominal part of the esophagus, stomach, and part of the duodenum up to the opening of bile duct and pancreatic duct. We know that in the second part of the duodenum we can get that starts from the abdominal part of the esophagus, very small part, that is around 1.5 centimeter. Then the stomach, then we are getting the part of the duodenum that is up to the opening of bile duct and pancreatic duct, which opens separately, or it may open, generally it opens in conjugation, which we know the ampulla of hepatopancreatic ampulla, which opens in the second part of the duodenum. So up to that position is the foregut. And we know that the main feeder is the, you can see that is the abdominal aorta, which has got 3 ventral branches. The upper one is the celiac trunk, we can see. So this is the artery of foregut. The next is the superior mesenteric artery and the inferior mesenteric artery. So superior mesenteric artery is the artery of the midgut. So midgut, that means from the last point, that is the opening of the hepatopancreatic ampulla in the second part of the duodenum, which opens at the posterior medial part of the inside of the second part of the duodenum, up to the junction of right 2/3 and left 1/3 of the transverse colon. So that is the junction between the midgut and the hindgut. And from the rest, from there up to the pectinate line of, we know that is the anal canal, there is a pectinate line up to which is the domain of the hindgut. So artery of midgut is the superior mesenteric and this is the artery of the hindgut. We have to remember some vertebral level. This is at the level of T12 vertebra. Superior mesenteric artery at the level of L1 vertebra and grossly, and the L3 vertebral level is for the inferior mesenteric artery. In embryonic stage, it remains above, and gradually that vertebral level, it comes down and vertebral level changes, and this is the adult position of the different arteries. So celiac trunk, superior mesenteric artery and inferior mesenteric artery. So the abdominal aorta has got 3 ventral branches and they supply the gut, whether it is foregut, midgut, hindgut. There are lateral branches, there are posterior branches, we will know gradually. Okay. Now about the celiac trunk, you can see sun ray appearance of the different branches. Okay, So we can see the celiac trunk or celiac axis also we can call it. After its origin, actually the length is only 1.25 centimeters, that means half inches. And then it breaks into three branches, major branches. One is left gastric, another is going towards the spleen, behind the stomach, that is tortuous, that is the splenic artery. You can see it goes behind the stomach, and another you can see within the lesser omentum, that means lesser omentum means there is a fold of peritoneum which connects the stomach and there is liver. Within the fold of peritoneum we are getting this celiac trunk and its branches, and another is going which is towards the liver, that is common hepatic. Again, that common hepatic, you can see after its origin it goes along we can get it within the lesser curvature. This is the lesser curvature and this is the greater curvature of the stomach. So it is in relation to the stomach and it is in relation to the lesser curvature and lesser omentum. Here it goes and it ultimately breaks into two branches, major branches. One is going towards the liver proper and another is coming behind. It goes behind the first part of the duodenum. That artery again breaks into two branches. So this artery is going towards the liver, it is called hepatic artery proper. And another is breaking, we are getting branch which passes behind the first part of the duodenum, and that artery most oftenly gets affected in duodenal ulcer. There is peptic ulcer, means both, whether it is ulcer within the stomach or within the duodenum, it is called peptic ulcer. And there are two types, one is gastric ulcer, another is duodenal ulcer. So that artery is affected. Okay, and we can get hemorrhage, hematemesis, melena means passage of black stool, altered color of the blood. So this artery is called gastroduodenal artery. That means it supplies, gastro means the stomach, and also it supplies the duodenum. So this is called gastroduodenal artery, which passes behind the first part of the duodenum, and also again it breaks into two branches. One is passing along the greater curvature and one is passing in this figure you cannot see, the C-shaped duodenum is there, and here is and within the C-shaped duodenum we can get the pancreas, head of the pancreas. So in between the head of the pancreas and the duodenum, this will move. So it should be called as pancreas and duodenum. So name of the artery should be pancreatico-duodenal, and it is superior pancreatico-duodenal because there is another artery which will come from the superior mesenteric artery and it will anastomose with this, which is called the inferior pancreatico-duodenal artery. So celiac trunk divides into three major branches. Okay, one is left gastric, and another is splenic, and this is the common hepatic. Among them, splenic is thick, which has got wide bore lumen. Okay, so that is also not only thick but also it is tortuous. Here in the face we can see the facial artery, that is also a tortuous, because we all mostly we perform the facial expressions. So for that, for liberal movement of the face, that artery is tortuous. So here there should be there is a liberal movement of the stomach. In empty stomach it sags down, but when it becomes full, so it's the change of and shape of the stomach takes place just after the heavy meal, just after your lunch. We can expect the change. There is a change in the shape and volume. Okay. So to accommodate that thing, we can get that splenic artery is tortuous. Okay. So from the splenic artery we can get so many branches which is supplying the stomach. You can see it is passing behind the stomach and it is supplying the stomach. These are we can get one is and also there is pancreas. Pancreas is here and it goes like this behind, and ultimately it is directed up to the left side. Then it will end at the spleen. Okay, the tail of the pancreas will end at the spleen. So these branches will supply the not only one is will also it will give some branches to the stomach, and also it will give some branches to the pancreas. Okay, so that is the pancreatic branches. One is not shown here, that is a posterior gastric artery is also there, which I cannot see it here, but it also gives a posterior gastric artery, and it also supplies some blood to the fundus of the stomach. That is we can get here. We can get some branches which is called short gastric arteries, which is coming out from the splenic artery. It supplies the fundus of the stomach, and one artery is very large and it can enter up to the head of the pancreas. So that artery is called big artery, supplying the up to the head of the pancreas. That is called arteria pancreatica magna. But actually it is nothing but pancreatic branches. So these are the branches. Now this is the left gastric artery, and from the hepatic artery either from the common hepatic artery or hepatic artery proper, we can get another branch that will move along the lesser curvature and joins with or anastomoses with this left gastric artery. So this artery should be named as right gastric artery. So there is an anastomosis between right gastric artery and the left gastric artery at the lesser curvature of the stomach. Similarly, we are getting this artery which is coming from the gastroduodenal artery. We know this is the right gastroepiploic artery, and this is another artery which is coming from the splenic artery, which is called left gastroepiploic artery. So there is another anastomosis along the greater curvature of the stomach. So that is in between right gastroepiploic artery and left gastroepiploic artery. So these are the branches, okay, of celiac trunk. Now about the gastroduodenal artery, one artery is above the duodenum. So that is called supraduodenal artery, which is also called the supraduodenal artery of Wilkie. And this is an end artery. For which, what will happen? There is no precapillary anastomosis. So if that artery is affected in duodenal ulcer, what will happen? Actually, this artery is most commonly affected. Okay, because this is an end artery and there will be affection of the duodenum. So the first part of the duodenum, okay, which behaves like the stomach, because that is also movable part. Okay, so in the first part of the duodenum, the duodenal ulcer is common. One of the reason is it is supplied by the supraduodenal artery of Wilkie. So there are other arteries like retroduodenal artery, infraduodenal artery. So the branches are coming directly or indirectly from the gastroduodenal artery. So gastroduodenal artery, the name suggests gastro means stomach and duodenum. So this gastroduodenal artery, this gastro means right gastroepiploid, and this is the superior pancreatico-duodenal artery. So this is about the celiac trunk. Now the next artery is the next artery we can see, that is the superior mesenteric artery. We can find it is hanging from the third part of the duodenum in the cadaver. Okay. The third part of the duodenum, and within the pancreas there is a process which is called uncinate process, like hook like, through which it is hanging. So that is the artery of the midgut, that is nothing but the superior mesenteric artery. Now the superior mesenteric artery, it is coming from, it is nothing but the ventral branch of the abdominal aorta at the level of L1 vertebra. Okay, and it is visible within the abdomen where over the third part of the duodenum. Okay, this artery is visible. Now there are some branches which will come from this is the artery, superior mesenteric artery. Okay, and it is continued like this. Okay, the main artery is continued like this. So it has got one concave side and one convex side. Artery is like going like this. So this is the concave side and this is the convex side. So this is the convex side and this is the concave side. From the concave side we can get one artery which is called the right colic artery. This one is the right colic artery, and this is the continuation, rather the continuation of the superior mesenteric artery, which is called the iliocolic artery. Okay, and another artery which originates from anterior part of the artery. This is the origin of the superior mesenteric artery. Okay, this is the concave side, this is the convex side, and this is the anterior side. From the anterior side we can see one artery is coming and it divides into two branches. One branch is going towards the right side and one branch is going to the left side. So this artery is called the middle colic artery. So we can expect middle colic, right colic and iliocolic artery. Three arteries. Why it is called iliocolic? It supplies the terminal part of the ileum and part of the large gut, colon. Okay, so iliocolic artery. This is the right colic artery. We are getting the terminal part of the ileum. This is the cecum with appendix. This is ascending colon. This is transverse colon, and this is the descending colon. This is the sigmoid colon. This is the rectum, which is continued as anal canal. So we must have some idea about the colon and so this is the junction between the small intestine and the large intestine. Small intestine we are getting, this is the part, is the terminal part of the small intestine, which is called the ileum. Other parts, duodenum, jejunum and ileum, which are not shown in this figure. Okay. So duodenum, we have got the branches, we have seen the supply. So jejunum and ileum, which we cannot see, but we can see the branches. Okay, which are arterial branches which are coming out from the superior mesenteric artery and supplies the jejunum and ileum. So from the convex side, we are getting the branches which will supply the jejunum and the ileum. Okay. And from the concave side, we are getting the right colic and ileocolic. From the anterior surface, we are getting, this is the middle colic, which divides into right and left branch. This right branch anastomoses with the right colic, whereas the left branch, this is the right branch, this is left branch. Left branch actually anastomoses with the left colic, which is coming from the inferior mesenteric artery. So this is the junction between right 2/3 and left 1/3 of the. This is the junction between the right 2/3 and left 1/3 of the transverse colon. So we can see up to this. We can see this is the supply from the superior mesenteric, and from here this is the supply from the inferior mesenteric. So this is the junction between the midgut and the hindgut. So here we can see the hindgut artery, that is the inferior mesenteric artery, which is coming from the abdominal aorta. You see, it is a ventral branch and it is coming at the level of L3. So celiac trunk is T12 level, superior mesenteric artery L1 level, and inferior mesenteric artery from the L3 level. So here from the inferior mesenteric artery we can see the left colic, and some branches are going to the sigmoid colon. They are called the sigmoidal arteries 1, 2, 3, and this artery which is continued, or rather the continuation of the inferior mesenteric artery, which is called the superior rectal artery, because it will go and it will supply the rectum. So in the left inferior mesenteric artery, we are getting this left colic branch. Okay, this left colic branch again divides into, one is ascending and descending branch. The ascending branch anastomoses with the left branch of the middle colic artery, which is a branch from the superior mesenteric artery. So this is the junction between the superior and inferior mesenteric artery. So you can see a continuous artery at the margin. You can see a continuous development of continuous one artery at the margin. Okay, and it supplies the gut, whether it is small, large, it supplies the gut. And this artery is called the artery of Drummond, marginal artery of the Drummond, which is been contributed both by the superior and the inferior mesenteric artery. So this arterial arch which is called the marginal artery of the Drummond. Okay, and we can see this is the inferior mesenteric artery. These branches are the sigmoidal branches, and this is the superior rectal branch. And here we can get one area which is called critical point of Sudek. Critical point of Sudek, there is no visible anastomosis between the superior rectal artery and the sigmoidal arteries here. So that point is called critical point of Sudek. That means there is no blood supply. Apparently there is no blood supply. There is no arterial anastomosis between the superior rectal and the sigmoidal. This is a sigmoid colon. Ascending, transverse, descending, sigmoid, S-shaped. So it is called sigmoid, which is again movable. This is movable. Okay, freely movable. This is the transverse colon, and which is hanging with the help of the transverse mesocolon. This is the sigmoid colon, which is hanging from the posterior abdominal wall with the help of one mesentery, which is called sigmoid mesocolon. And this is the rectum. So within this sigmoid colon, there is a point. There is a lack of anastomosis between this superior rectal artery and sigmoidal artery. This point is called critical point of Sudek. But if we see histologically, we can find there is or microscopically, if we can watch that area, we can find there are some arterial anastomosis. So the critical point of Sudek is a misnomer. Critical point of Sudek is misnomer. So in nutshell, there are three arteries for the gut. One is foregut, artery of foregut, that is celiac trunk. Jore bolo, celiac trunk. Artery of midgut, superior mesenteric artery. Artery of the hindgut, inferior mesenteric. Celiac trunk has major three branches: left gastric, one is tortuous splenic, one is common hepatic. The hepatic artery is going towards the liver. So again, that going towards the liver, which ultimately divides into right and left hepatic arteries. From the right division, we can get the cystic artery. From here, we can get some supply towards the bile duct also. So this is the artery it is going towards. It is meant for the liver. So it is called hepatic artery proper. And another artery is coming down, passing behind the first part of the duodenum, that is the gastroduodenal artery, which divides into superior pancreatico-duodenal and right gastrofluid. Similarly, here we can get from the anterior aspect, that is the middle colic, from the concave aspect, right colic, ileocolic, and from the convex side, we are getting the jejunal and ileal branches. Okay. Now we can see one artery here, which is said to be the first branch. This may be the first branch, or this may be the first branch of the superior mesenteric artery, and that passes in between, and another artery is coming from above. This artery is coming from below. There is an anastomosis, that is superior pancreatico-duodenal, and below one is the inferior pancreatico-duodenal artery. You can see this is inferior pancreatico-duodenal artery that resides in between the head of the pancreas and the duodenum. Okay. So there is an anastomosis between the artery of foregut and artery of the midgut. So inferior mesenteric artery. And we can get from the ileocolic arteries, we can get the cecal arteries, anterior cecal, posterior cecal, and we can get a separate artery for the vermiform appendix, worm-like appendix. That is the appendicular branch. So, appendicular branch is generally a separate artery. It is coming from the ileocolic artery, or it may come from the anterior and posterior cecal arteries. There are variations in the body, in the cadaver we can get. So it is coming from the, so we can get, this is appendix, and it is hanging with the help of the mesoappendix, and within which we can get the appendicular artery. This is the first surgery we perform during internship. That is the appendectomy. Each and every intern is given with a chance of performing appendectomy. So here we have to find out the appendix and its blood supply. That is the appendicular artery. That is coming from the ileocolic artery. Okay. So rest of the arteries, but I should not mention anymore. Okay, I should not waste your time and I should not tax your mind also. So that is the inferior mesenteric artery, that is the left colic, sigmoidal branch, and superior rectal branch. The superior rectal branch is said to be the continuation of the inferior mesenteric artery. Here the ileocolic is said to be the continuation of the superior mesenteric artery, and inferior mesenteric is continued as superior rectal, which divides into two branches, and it will supply the rectum and anal canal up to the level of pectinate line. The pectinate line means what? There is a curved line within the anal canal. We will get the part above. It is contributed by the hindgut. Part below, it is from the, we know, endodermal cloaca and ectodermal cloaca, that means ectoderm. So that is the junction between two separate layers, primitive layers. We know ectoderm, mesoderm, endoderm. So that is the area, the pectinate line is the area between the endoderm and the ectoderm. Okay. So below that area, it is from it will be supplied by the somatic or body arteries. Okay.